really great to yeah, I'm just going to talk through that if it happens. And please feel free to put questions in the chat throughout the presentation. A lot of what I'm going to go over today is different resources we have at the American Dental Association and just some recent news, metrics, all of that fun stuff. But really my goal of today is for everyone to just know where the right resources are and spark some questions and get some clarification. But I do work for the American Dental Association for about 2 years now. I work primarily in fluoridation, and it's been quite a year for fluoridation. And we're really glad to hear that, Park Hills was able to reaffirm their support for water fluoridation with a lot of the work that folks here today made possible. Let's see if I can advance my slides. So yeah, so the goal, the kind of areas we're going to review today include community water fluoridation, dental sealants, and then a little bit about the youth vaping epidemic. That's still something that is on our radar, especially with COVID-19. And we'll be having a webinar actually later this month, and I'll have a QR code for that later for you to register. But these are kind of the big three themes. And it was great to hear Dr. Hilton is actually the chair of our advisory committee on dental sealants at the American Dental Association. So a lot of what she shared earlier today is very similar to the kinds of messaging that we're doing. Our goal is really to encourage dental providers to place dental sealants and make it kind of make it a standard practice. I'm going to jump in with water fluoridation and some recent updates to fluoride that you may or may not have already heard about. Again, I can't see the chat box right now, but please put in questions about this because this is a very nuanced update. So the National Toxicology Program has been doing a draft of fluoride exposure and neurodevelopmental and cognitive health effects. And the NTP has done 2 drafts, and both times they have found fluoride as a presumed neurotoxin. Now, this classification is not linked to any sort of threshold effect. And that's really important when we talk about things like fluoride because it's all about the low dose chronic exposure. And the levels we have in water fluoridation are not linked to any sort of adverse health effects. Right now, there is some, investigation about optimal fluoride exposure and fluorosis, but there's no data that, supports cognitive impairment with water fluoridation and using optimally fluoridated products. So the ADA, they sent a letter in October to the National Academies of Science, Engineering, and Medicine asking that they recommend to change the classification to unknown. And the national academies, they're the overseeing body of the National Toxicology Program. And on February 9th, the National Academies released their review saying that the committee, saying that the NTP's report, there were some concerns, there were some worrisome inconsistencies, there was unclear conclusions as to the data they used. So they really advised the NTP to revise their monograph. Now, how this could impact those that are proponents of the evidence-based water fluoridation is folks can misuse the National Toxicology Program monograph and say fluoride's going to lower your IQ, it's going to lower your child's IQ. And we understand how people can misinterpret evidence that way. So it's really important that those that want to offer evidence-based public health practices to know the nuance that this does not directly correlate, even this presumed classification, even though it may be even misinterpreted or be in false conclusion, even if it were true, it wouldn't impact the levels we see in water fluoridation. And we are calling for more research for this as well. There's a lot of those that work in research and science that are saying, let's continue to investigate this. It's important for us to always be able to see if what we're recommending is truly the best science and truly what's best for the population as a whole. And the evidence right now does still continue to support water fluoridation at 0.7 parts per million. As a reference, the first kind of threshold effect where there may be an adverse event, which is the fluorosis, is 1.5 parts per million. So that's over twice as much that's in water fluoridation. So really, you get the dental benefit without any risk. The National Academies Committee advised the NTP to make it clear that the monograph cannot be used to draw any conclusions regarding low fluoride exposure concentrations, including those typically used with water fluoridation. I share this quote with you because you may be faced with addressing this at a city council meeting one day, or you need to address the NTP report that a patient may bring into the office because we think it's very important for folks to question things, but also to truly understand the implications of them. And this quote here, I recommend that you have it in your back pocket because you may need it one day. We'll answer more questions on this later. So I'd like to do a little overview of water fluoridation in 2020. It was a very unique time with city council meetings going virtual for the most part, and that resulted in a brand new platform for water fluoridation challenges. And with those challenges, you had a lot of folks who are staunch anti-fluoridationists and a lot of folks who are, evidence-based fluoride advocates and public health advocates. And they would meet virtually, and you would have a percentage of people from the actual community that's leading the initiative, and then you'd have international representation as well from folks who are really in the weeds with fluoride on two different sides, you could say, of the spectrum when it comes to fluoride. And our goal is always to encourage the community to get involved and read the evidence and listen to their health professionals and their community organizers to really understand what's going on with fluoride, because it's very easy for misinformation to spread at the community level, and we want to make sure that communities are empowered when it comes to making this public health decision. But it was great to see that 71% of those that faced challenges in 2020 were able to reaffirm and continue this public health practice. And as you can see, Park Hills is one of those communities. Now, there were 4 challenges in Wisconsin. I'd like to just kind of note that there's a anti-fluoride activist in Wisconsin that kind of went around to these different communities to try to remove fluoride from Wisconsin water. So that's why we see some more activity there from last year. But we're looking forward to another year of, not just reaffirming water fluoridation, but hoping to start some programs. I don't go into this presentation on the science of water fluoridation. We have presentations and webinars on that. So I'm happy to go through the science, in another time, or if you want to follow up with me. But our goal is really to educate communities and start expanding this program, even though we had a year of focusing on reaffirming those that were faced with challenges. What's really exciting is we see Spokane, Washington recently voted in approval for a grant to support water fluoridation. Now, that doesn't mean water fluoridation is necessarily starting, but they have the support to do so. So it's really great to see that some communities are working on that. We know with COVID-19, public health budgets were pretty tight, and the American Dental Association reached out to leaders across the nation to reaffirm the science and support to prevent caries wherever we can, especially when there may be other barriers to accessing care. And, we had a great presentation on sealants and teledentistry. So it's always important to also, remember that water fluoridation is sometimes the first line of defense for a lot of young people in the community, and it has lifelong benefits. So we really hope that this, economically and health equitable program continues. So part of what we try to do to encourage leaders in the community, especially dental providers, to take action on fluoride is to always know where the right resources are, how to take action at the community level. I know that Missouri's Oral Health Coalition has done a lot to engage the community first, talking about, the burden of dental caries in the state. Focusing on different ways that interventions could be implemented to prevent caries, and then coming to the conclusion that water fluoridation is equitable and economical and has a population level impact, rather than starting the conversation with we need water fluoridation without all of that background work. So that foundation of the value of preventing caries and then the opportunities, fluoride, fluoridated drinking water is often a easy win. the hardest part is really addressing the misinformation. And sometimes there's a barrier with implementing infrastructure at the Water Bureau. So connecting with those that would be part of the engineering process of it is really important. But we noticed that the biggest hurdle is always addressing the misinformation. And it's really kind of getting out of control with Twitter and these echo chamber communities where false information is being shared very um, and a lot of it at once. So if there's one thing that doesn't implement hesitancy, there'll be something else. So it's really important for those that support evidence-based interventions to share the evidence wherever they can. And this resource was released last month. It's been peer reviewed by a number of dentists, public health practitioners, health literacy leaders to make this a robust resource for professionals to use, to just have some quick facts about fluoride, know where you can get more information, and kind of a guide to both knowing if your water is fluoridated and how you could potentially initiate fluoridation if it's not. Then we also have a book called Fluoridation Facts. It is free to the public in its digital form. You could also order it on our ADA web pages. So again, that's ada.org/fluoride. You'll see all of this information. The book is one of the first things you'll see. And it's all evidence-based Q&A with references right there. It was last revised in 2018, and we're likely to start coming out with a new one in either 2022 or early 2023, because there's been so much activity with fluoride. We're gathering the data to make a very relevant and up-to-date book. It includes some of the latest activity with fluoride and neurocognitive development and synthesizing all of that data. I do recommend, if you don't already have this resource saved somewhere, to have it, to look through it. There are a lot of different questions about fluoride that have circulated, from thyroid effects to higher risk of cancer to higher risk of bone density decreasing. So I really recommend you look at the evidence in this book. It explains it much better than I could, off the cuff. So please go check it out. And if you have any questions about the data in it, my contact information is also on the last slide. So please reach out. We're always looking to improve and update and clarify our resources. So I'm going to start kind of pivoting away from fluoride. And again, any questions about that we can save for the end. I would like to say, happy late National Children's Dental Health Month. That was in February. We have these free posters and activity sheets on ada.org/NCDHM. So it's National Children's Dental Health Month 2021. The theme was water, nature's drink. It's really about choosing water over sugar-sweetened beverages and juice, especially when kids are at home more and they can go to the fridge and maybe grab something, or a parent can grab something that's not water, to really encourage drinking water, not just for oral health, but drinking water. Our bodies are primarily water, so having a healthy body also helps us protect against available for about 5 more days. Anyone can order them. You may, if you're not an ADA member, you can do a ADA login. It's free to make. It's just like any other kind of website where you just need to have a login. So there's a prompt you can follow to be able to order them, but member or not, they're free. They'll be shipped to you. They come in English and Spanish. I included the English version for the PowerPoint, but the Spanish version you can see online. Same message. They're also printable, and they're a printable activity sheet. So if you have little ones at home, you can always print it out for them. There's also a coloring sheet. So, if you want to color, it's right there for you. But it's a really good resource. We do these every year. We have a poster every year. So we're really excited about this year's theme, and the posters are available, so go order them. Why not? They're good for giving to teachers, or if you have any community areas, they can go anywhere. Dental offices, dental schools can have them in the operatories, especially for students. So they're very versatile. And now we're going to talk a little bit about sealants, but I know Dr. Hilton did such a good job of going over sealants. I don't know if there's any really new information here. ADA is working on putting out an evidence-based one-pager on dental sealants with COVID-19 and really thinking about aerosol generation and low aerosol generating procedures and the focus on prevention. So this is a prime time for us to talk about disease prevention and specifically oral disease prevention. If you're here today, you know I'm speaking to the choir, but I know that there are still a lot of folks that are unsure about dental sealants. My sister was unsure about them for her kids. She was like, there's already decay in their mouth. Should they just do a filling? And so kind of going over the science to the best that I could. But I know as dental providers, sometimes there's a learning curve with parents, especially younger parents, because they may not have had sealants and we don't really know what they are. I didn't know what they were until a couple years ago. So, and I work in oral health, public health. So there's definitely a learning curve out there in the community. And, we hear about fluoride to an extent and tobacco and vaping, but there's still a lot of opportunity to socialize dental sealants. Dental sealants and optimal fluoride exposure are the two most evidence-based preventive interventions in dentistry. So if you took that pre-quiz yesterday, there's the answer. So the goal is really low aerosol generation. And glass ionomer sealants. I'm not necessarily recommending glass ionomer versus resin, but glass ionomer dental sealants can be placed in a manner that minimizes aerosol generation. And overall, it's effective in preventing and arresting caries. And I would like to show, kind of just highlight the ADA's 2016 clinical practice guideline that it does support everything we've been sharing today about sealants. So it is evidence-based. These recommendations are not, conjecture. There's data to support that sealants can prevent the progression of early non-cavitated caries lesions. And our final topic today is tobacco and vaping. Specifically vaping, we do see that there's been a reduction in using cigarettes. So, in 2016, about 28% of, I think, I don't have the heading here, so I apologize for that, but I think this is youth use of a cigarette versus an e-cigarette. 28% have, in 2016 have used a traditional cigarette, and then in 2019 it was 22%. But e-cigarettes, and this is one-time use, not chronic use. And then e-cigarettes in 2016 it was 39%, but 2019 it was 46%. And that's why we call it a youth epidemic, because that's almost half of the youth population. And it's quite alarming. And nearly 90% of adults who smoke cigarettes daily, they tried smoking cigarettes by 19 years of age. So this is potentially a whole cohort of new folks that have either nicotine addiction or vaping addiction. Even if there isn't nicotine, there's evidence that the liquid glycerol in the vape pod, so that liquid stuff, there's a glycerol in there. And the glycerol basically it suffocates the mucosa because the mucosa kind of eats up this glycerol, and then it kind of looks like chia seed pudding. Now, I'm not explaining this as well as Dr. Parmeena Kumar, who is doing a webinar for us. I'm going to just jump to that, doing a webinar for us on March 25th from 12 to 1 Central. So that's the QR code. I hope it works. But it's going to dive into all of this latest evidence on vaping and really show that vaping is still very much a concern for not just the public health community, but definitely the oral health community. There's a ton of new research that's still being conducted and evaluated based on those that are using different kinds of vape pens. But we are seeing that it's not just if it contains cannabis, it's not just if it contains nicotine, but even there's like vitamin D vape pens. Even those can impact the oral mucosa and cause things like xerostoma or higher risk of periodontal disease. So there's definitely still a concern for vaping. And understanding how to talk to parents and youth about this. Folks don't take up, a lot of times folks take up vaping because they're stressed or need to find some sort of escape, or their friends think it's cool if it's younger. So there's a lot of different reasons why folks take up vaping, and it's not to, shame them for using it. It's more of to understand the potential risks of using these products and empower them to start the process of using e-cigarettes and vape pens less, or completely quitting. And then here are just some fun facts about e-cigarettes with nicotine's impact on the oral cavity. So I don't want to just read the screen, but we do see that nicotine in e-cigarettes still impacts the oral cavity in a different way than traditional cigarettes do. And right now there's kind of a discrepancy in terms of the recommendation. So, if someone is using traditional cigarettes, do you advise them to use e-cigarettes instead? Because the vapor may not have as much, like secondary exposure, or it might be better. There isn't a lot of evidence that traditional cigarettes really are effective in helping folks quit, but it has helped some. The research is contradictory, so it's not really replicated clearly. There's also some evidence that traditional cigarettes and e-cigarettes it's kind of like, it's comparing two totally different products. So if you're trying to say, quit using cigarettes and use e-cigarettes instead, you're introducing a whole new product with a lot of unknowns to them. And there hasn't been enough research to really know all of the long-term risks. So it definitely, it would be incorrect to say that e-cigarettes are better than traditional cigarettes, because it's a totally different type of product, even though they both contain a lot of similar components. But the glycerol and the vapor and how that's impacting the mucus, there's still a lot to understand about it. And there was a time, where I was trying to talk to someone and they were using traditional cigarettes chronically. And I said, well, what if you try e-cigarettes? And this was before I knew anything about, the liquid glycerol. So, I've pivoted away from that recommendation. And they are addictive, especially if they have nicotine. It's an addictive product. So definitely addressing the youth and families about this is a part of protecting the oral health and total health of a whole generation. And that's the webinar. And I thank you for your attention. I wanted to leave quite a bit of time for questions, because I'm sure there will be. But that is my email. Are there any questions? Fluoride, sealants, vaping.
You covered a lot of material there.
It was a lot. Yeah, I kind of ran through that, but I hope it was helpful.
It was great. It was great.
Would you mind putting the QR code back up
Yes.
again so I could get a picture of it?
Yeah. And you can, you should be able, if you have a smartphone, to just open your camera and then it'll take you to the registration link. Yeah, I just tried it, so it works. And we'll have 3 speakers at this event. There will be Dr. Pramina Kumar, who she does all the tobacco and vaping research for the she's our spokesperson for tobacco and vaping at the American Dental Association. Has done a lot of recent fascinating research with the mucosa implications of vape pens. And her big takeaway is, while all vape pens can pose a risk, those that contain cannabis are extremely harmful. I don't have the data with me right now, but that's her takeaway from the evidence. Is different products she calls it suffocating the mucus. It's going to suffocate the mucus a lot faster. And there was this novel lung disease that was happening with a lot of folks who were using these vape pens. That was from a different kind of, I think it was a vitamin D liquid that was in the pods. And I think they, for the most part, have taken that concentration out of a lot of the vape pens, but there are still, adverse health outcomes, both to the lungs and to the mouth for using vape pens. But there was this, it was like July 2019, June, July 2019, where there were a lot of folks with this lung disease, and we've seen that decline since the product has changed a bit. But it's still, there's a lot of unknowns to the products and what's in them. The ADA is also signing on to a national policy to regulate the menthol in some of the vape pens as well, and regulating the flavors. There's a lot of work being done to regulate these products. Yes.
We have, well, a couple of thank yous and some questions about the QR code. I have put a link which will take you to an ADA web page that talks about the webinar on vaping, and there is a registration link on there. And then we do have a question. I imagine the issues with adolescent dental health are only exacerbated by the increase in vape pen usage among that age group. Any interesting programming trying to reach that particular age group?
Yes. So the ADA, we work closely with the Campaign for Tobacco-Free Kids, and that campaign is doing a lot of work with vaping. And right now we're discussing opportunities to really address the dental impact of using vape pens as new research is coming out about, how it actually impacts the mucus. We, of course, only recommend things if they're truly evidence-based, and we're still working on collecting all of that best evidence. It's been about 2 years that this has been a focus, and then with coronavirus, there's all these new kinds of possible confounding effects and not being able to conduct the research, especially if it's involving something that's going to need aerosol, it's aerosol generating, and you need folks to come in to do the research. There's been some new barriers to doing research, but the campaign is working on some messaging, and the ADA is currently doing a review of what we have, these lesson plans on our Mouth Healthy pages, and we're including tobacco and vaping in these oral health lesson plans. Now, the goal of these lesson plans is for 7th and 8th grade educators to use them for a health class, and a health class focused on oral health, like a one session of a health class for a term. And in it, there's the implications of tobacco and vaping, and trying to make it very relevant to what youth may be exposed to or using. And also, addressing the stigmas that come with such usage, because it's not the individual's fault. There's been a lot of misinformation directed at youth, targeted advertising at youth, just there's been a lot of alarming advertising to bring in the youth to this new generation of folks that are using these products. So, we just want to make sure the right education is getting to these communities and empowering them to quit or to encourage their peers to quit. There's also Truth Initiative, and I highly recommend you look at their products. We have some links to them on our pages as well. But Truth Initiative, it's also led by young people. And of course, they partner with scientists and they partner with celebrities. And really, the goal is that before e-cigarettes were so popular, their whole thing was like, we're going to be the generation that quit smoking. We're going to be that generation. And they were actually going there. There was this whole downward trend where kids weren't really using cigarettes anymore. And then vape pens came out and e-cigarettes came out, and there was this idea that it's safe and it's fun and it's cool. And that's when you just saw the opposite, and the use skyrocketed. And in the last couple of years, there's been some more clarification on that there is nicotine in these products, and they are addictive and they are harmful. So the more that we can socialize that and really make that clear, the better you can protect our communities. All right. Oh, and thank you for putting the link to the webinar there. I see another question about the 75th anniversary series. So the ADA does have those recorded. They are free to access. Again, you just need that ADA login, like kind of organization login, but it's free to get a login. It's a 4-part series that we did back in July 2020, of course, virtually. And we've had some wonderful speakers. There's different themes, and we do dive into a little bit of the neurocognitive implications, and even someone who published the research about fluoride and possible neurocognitive effects, still saying that, if she were pregnant today, she would drink optimally fluoridated water. So it's a pretty powerful webinar series, and it really goes from the basic overview of water fluoridation to more specific science, to how to do an effective community campaign. So in terms of new fluoridation events, we don't have any new events on the horizon. There may be a couple presentations done throughout the year at other conferences, but a focused event right now is not what we're really working on. Updating fluoridation facts and that manual, so more resource building is our focus right now, since we just did the webinar series. So fluoridation facts will have another iteration. We're also working on updating our compendium, which is the list of all the professional organizations that support water fluoridation. So it's more resource building right now. Great.
That's great. Well, other questions or comments?
Are there any questions about the fluoridation research? Because I know that it's quite nuanced, and there's been a lot of misinformation about it, which is understandable because it is such a nuanced science.
Not a question, it's just very thorny to deal with community members who are picking up all this garbage off the internet, and then there's what appears to be a completely legitimate source saying it's problematic or possibly problematic. So it's bad timing.
Yeah, so a number of us who are oral health Twitter folks, and we're on different groups on social media trying to address, oral disease prevention. There's a lot of hesitation around water fluoridation. And John, I'll get to your question in a second, Dr. Dane. But with the hesitation, I think it's just really important to continue to share the information wherever you can. And there will be it's easy to put something out there and then receive a lot of negativity and then choose to disengage. And I understand that, because if someone is making it more personal, then it's not even about the science anymore and clarifying the evidence. That's why I really recommend fluoridation facts, because you have all the evidence right there, very clearly spelled out. So that's why it's a good resource to have. But part of the fluoridation webinar series that the ADA put on in July is a session by Dr. Brittany Seymour that dives into the different types of misinformation and how these kinds of things spread. And a lot of it is because they're trying to cause distrust in the individual who's sharing the information. As an example, I recently was sharing how there's been these large cohort studies that have looked at fluoride's impact at the community level, and they saw no adverse health effects. One was a review by the ADA, one was by the CDC. And when I shared that with them, they go, "Oh, you want me to trust the CDC? Like, that's biased." So, at that point, it's going to be hard to convince someone that, this is high quality evidence-based research that a high level quality organization is going to have to do. And trying to compare, two kindergartens, and one had fluoridated water and one didn't, and the caries rate was the same between these two kindergartens, is very different than a 700 person study that sees the difference at the population level of caries rates between fluoridated and non-fluoridated areas. So it's really important to also look at the kinds of studies that are being shared, because some of them are not reflective at the population level. And I always, try to share that if the evidence were compelling enough, if the evidence were even compelling, or we wouldn't continue to support water fluoridation if it really did show risk. That's why we ask for research to continue, because we're not here to support fluoride. We're here to support the prevention of caries. And those two usually are separated. When someone sees someone who's an oral health advocate and a dental advocate or a dentist, they'll think, oh, you're forced to say you like fluoride. No, we're actually we have a personal mission to address dental caries, and we're not going to ignore how addressing that impacts the whole person. But again, it's just going to take a continued advocacy and using the evidence. I don't even call myself like a fluoride proponent. I consider myself an evidence-based fluoridation proponent. Like those are two different things. So it's not a blind support. I've questioned it a lot, and I've come to the same conclusion. But I do think it is important for us to continue to look at the evidence, and I applaud those that do. But it is also amazing to see two different communities that are similar in every way, but one has fluoride and one doesn't, and you see the difference in caries. I used to work in Portland, Oregon, and I saw the difference between Portland and Seattle at the numbers. So it's very clear that two communities that are very similar could have just such a different disease burden because of something as simple as fluoride. So that's exciting in terms of the opportunity to educate. So the EPA lawsuit, so that's been something that also, there isn't much that I can say about it because I'm not directly involved with it, but I have been following along. So in terms of, what is out there, it's all that's public is, it's been an ongoing trial for those that want to, like, what EPA lawsuit? So basically there's been a group of folks that have been suing the EPA. It's a group they're called Waterworks, and it's a lot of the folks that are staunch anti-fluoridationists that are basically saying that the EPA's classification of neurotoxicity of fluoride isn't accurate and is harmful to the public. What has happened is that the judge has been primarily looking at seeing what does the NTP report say, the report that I was first presenting from the National Toxicology Program. Now that National Toxicology Program isn't quite clear and is actually clear enough to say that no matter what, it's not going to implicate water fluoridation levels, they're looking at settling and having some sort of settlement agreement. I don't know what that's it. Like, negotiations haven't really happened yet. We're just following along. But at this point, it looks like I don't want to say it's going to fizzle out, but there's going to be some sort of agreement that they come to. And the judge has recommended before for the plaintiffs to resubmit. So now that there's a whole new slew of evidence out, for them to try again, basically, if they want to. But the evidence that, water fluoridation as a practice is safe and actually prevents disease is compelling. So I hope that answers your question. But it's it's been a stay tuned. And then I see another question about adult cigarette smokers increasing vaping. So I don't know so much about that. The evidence that I have seen that is on it's the Campaign for Tobacco-Free Kids, but it also has some information on adult cigarette smoking, and this is also at the CDC, is those that try to go from traditional smoking to using e-cigarette smoking usually are not successful in completely switching over, and don't like it's not the same kind of product. So it's like comparing, like, instead of smoking, I'm going to have a glass of wine every night. Like, it's a completely different product. So the evidence on that has been basically for those that try to switch to vaping, which was the original intent, they say, of the product, is that, oh, this is a great product to reduce secondhand smoke and for adults to be able to quit. And that's still a recommendation. There is still this recommendation for traditional smokers to try to transition to e-cigarettes for the purpose of quitting. But the evidence has shown that that hasn't really worked. But most of the data collection is on youth because it is such a boom in their usage. But I'll try to find more. I'll try to look more into that, see if the CDC has new information. And we have from 2019, it was May 2019, so it seems like forever ago, a pandemic ago. We did a webinar on e-cigarettes, and it's just the very basic information. So the one we're doing in March is a little more detailed on vaping and the current evidence on its impact on the oral mucosa. We have a free recorded webinar on e-cigarettes from May 2019 on our ADA e-business pages. It's worth one continuing education credit if you watch it. And it has more of the basic information on the products, their usage, and more of that population level impact rather than the science of the oral health impact.
Other questions? Well, you may have exhausted their questions. So I'm going to say thank you so much for an excellent and very informative presentation. Thank you for being here. And I need to give everyone the CEU code for the survey. Again, the link is on the coalition website, and the code is evidence. And we'll get that in chat too, so you can have it. And then again, for those of you who maybe did not hear earlier, the CEU surveys are only up on the website through close of business Monday. But before we move on to the next, let's give a big hand for Tuka, even if she can't hear you. All right. Thank you. It is difficult doing a presentation over a virtual platform because most of the time you have no idea if people are paying attention or asleep or making faces or anything. Very different than a live presentation for a presenter. But thank you. Great job. Really great information. Ashley.
We have one more exhibitor focus for this afternoon, and that is from the Department of Health and Senior Services Public Health Information Management System. I will turn it over to that group.
Hi guys, this is Whitney. Can I get a sound check?
You're good, Whitney.
Perfect. Let me share my screen here. I debated going out and doing a live demo, but that kind of makes me nervous when going through a system like this. So we did put together just a few slides about our data system. So I think many of you have probably heard about the Missouri Public Health Information System before, the MICAs and profiles. We're very grateful to be part of this conference. I think we've been attending with our dental health partners for several years. So very grateful to be part of this group, and just wanted to share for anyone who is attending this conference for the first time or maybe hadn't seen our exhibit before, a data resource that's available for you as your as our previous presenter had said, looking for the evidence and making evidence-based decisions, applying for funding and other things of the sort. You can get to our website through the Missouri Department of Health and Senior Services homepage. You can see the screenshot I have on the top left here. To the far right of the homepage, there is a Data and Statistics tab. If you click on that, it will bring up the page that you see in the bottom right. And there's several different data resources available here. some of which are survey-based and do include dental health information. So I do encourage you to explore this at your leisure. But the tools I want to talk with you about just very briefly today are the MoFIMS tools, the profiles, and the MICAs, which we've got highlighted there in orange. When you go to our homepage, this is the first screen you will see. Our system's kind of broken up into 3 different buckets. We've got the data profiles, which are more of a one-stop shop. If you want kind of a brief overview for a health condition, a certain population of interest, or a community of interest, you can come here and get a whole lot of information really quickly. In the middle, the data MICAs, this is where you can really slice and dice and custom create a data set. So if you really want to drill in on dental health issues for a certain zip code, your high school level kids, that information would be available in the data MICAs. And then finally, the EPHT section are all of our environmental or environmentally associated public health conditions. So we do have some information in there about water quality. I don't think they've added information about fluoridation quite yet, but I do believe that is on the horizon. All of this information is publicly available. However, if you do sign up to be part of our user group, you do get a few special features there. I did just want to really briefly show you guys some of the oral health based information that we have available on the system. So this is the county level study profile. In Missouri, they do the county level study every couple of years. It's really dependent on funding, but it is a telephone survey for adults age 18 and up. I know that we were looking at some data related to St. Francis County over the course of this conference, so I really wanted to tease out some data associated with that jurisdiction. You can see here, if you click those drop down, you'll get some other options. We've got all of the counties in Missouri that have data available. We also have some cities and some regional data. But basically what you can see here is there are a couple of questions on the bottom. Folks who needed to see a dentist in the last 12 months but could not due to cost, so weren't able to get into the dentist in the past year because of financial issues. And then also last visited a dentist more than 2 years ago, so going 24 months at least between seeing their dental provider. The number of respondents column just shows how many people responded to that question. And then the prevalence is how many answered in the affirmative here. So in St. Francis County, about 19% of their residents did need to go to the dentist in the past 2 years, but were unable to do so because of cost. Close to 25% of their residents have had an interval more than 24 months before or since their last visit to a dentist. So again, this information is really useful if you're trying to build a use case, if you're trying to get programming set up in your community to show, hey, we're not just spinning this up for the sake of spinning it up. We've got a need here, and we need to make sure that we're addressing that need. I know some folks, especially if you've got a few minutes with your stakeholders, a bunch of numbers is usually not the best way to go about things. So on the community data profiles, if you click on that blue graphics link, you'll be taken to a page that looks like this. And I apologize, it's very small on this screen, but where we've got just some data visualizations of that information we were sharing. So you can look at maps showing whether or not the rate in your community is statistically significantly higher or lower than your neighbors, kind of where you fall in the scheme of things comparing to other counties, as well as comparing what your rates look like compared to the state average. So you can see here in the bottom right, St. Francis County has a higher rate of folks who have not been to the dentist in 2 years than the state average. All of this information is downloadable, so you can download it, create new charts if you like, copy PDFs, pop them into a presentation, and you're ready to go. Transitioning over to the data micas, they're a little bit different. They're a little more touchy to use just because of the sheer power of them. You can really slice and dice to get the information that you need. You can see if you look at this background image here, you can slice and dice the data by year, by different geography, by different age groups, because we know certain oral health issues affect different groups of the population. You can look at it by other demographic information if you're looking at equity or inequity. But what I did here is I just pulled anyone who had had any sort of a dental procedure over a 3-year time period for DeKalb County. And you can see in the nearer image that the rate of operations and dental procedures in DeKalb County is a little bit lower than average for the state, but increasing over time. So something that our oral health providers in the area might want to pay attention to. It might be worth drilling into some of their surgeons in the area to determine if there's anything specifically that is causing folks to come in and have these procedures done a little bit more. But again, this is a very powerful tool because you can really dive into the specific population and get pretty specific in your research questions. Then I just have our contact information. Andrew Hunter, Andy Hunter, many of you guys know Andy. He and I are always available, and James Owen's been sitting in with you over the past 2 days, kind of getting to know some of our partners. He's a newer research analyst in our unit. If you have any questions at all, feel free to reach out to us. Again, I do encourage you to check out the system as you have time. I know that that Brad and Jessica are going to send around the presentations here, so we have included a link to the homepage so you can get there. And again, we're always available to answer any questions. If you need any data pulled out, please get in touch with us. We're nerdy and like doing that kind of thing. So with that, I will turn it back over to Brad. Thank you so much for having us today, and I hope everyone has a wonderful, wonderful weekend.
All right, so we have a little bit of a break scheduled at this point. And before we do that, I want to say thank you to Whitney for that excellent little presentation there. That was great. And if you give us your slides, I don't know if we have them, but we could put them on our website too. Well, we're a little ahead of schedule. I think we probably ought to try to start the next session, which is oral health advocacy skill development by me and Ashley Herman, and that does include small breakout discussion. I think we probably ought to start a little early for that. Let's say instead of 3, let's say 2:45. Anybody want to object to that? Raise your hand or put it in chat. I'm not hearing or seeing any complaints about that. So we're going to go on break now, and we'll be back at 2:45 and for an exciting oral health advocacy skill development presentation and small group discussion. And after that, we will close out the conference. And so I will talk to you briefly. Thank you.